Relapsed refractory multiple myeloma patients need novel therapies that are active and also well tolerated. I think quality of life, a study from Horizon trial showed that these patients do have a high disease burden and suffer from symptoms of multiple myeloma. Horizon study was a phase 2 trial investigating Melflufen, a novel alkylator in combination with Dexamethasone. It showed an overall response rate in a heavily pretreated patient population, that would be patients with triple refractory multiple myeloma, penta-exposed, also patients with extramedullary disease, had an overall response rate of about 29%. And 44% of patients had a clinical benefit from this treatment, meaning that they had at least minimal response. So progression-free survival was in the range of 4 months, but the overall survival was under a year, 11 months or so. So these are very encouraging results, and they are very well balanced with a safety profile. We do see some hematologic toxicity, which is expected for alkylators. But with Melflufen, we don't see a lot of GI toxicity or alopecia, which is important for quality of life of patients. Well, that's a very good question, and as we speak, work is in progress to identify those biomarkers, but nothing that I can share right now. Right, the Ange study was also presented in this meeting. That's a phase 2 trial exploring Melflufen in combination with standard of care regimens. So combination with daratumumab is the most advanced in that study. We saw response rates of 80%. Progression-free survival is early yet to comment on, but with a follow-up of 6.6 months, the progression-free survival is 14.3. There's also combination with bortezomib, but that's a little bit early in development. There's not a whole lot of data, patients enrolled in that portion of the study, but what we have so far, results are also overall response rate in the range of 70%. Right, so alkylators have certainly had a space in multiple myeloma for a few decades. Melflufen, as you know, was the very first drug ever approved for multiple myeloma. Melflufen is a unique alkylator because it is a peptide conjugated alkylator. It creates a very lipophilic molecule that can penetrate cancer cell. And then as it is cleaved by peptidases, which myeloma cells are very rich in, it gets trapped. So there is a highly cytotoxic payload that's delivered in a very targeted fashion. The idea behind is that should help to prevent systemic toxicity and increase the potency of the alkylator. And I think the data of the study certainly support that hypothesis.